Local anesthesia in surgery. Local anesthesia is a widely used method to manage pain during surgical procedures. It involves the temporary blockade of nerve conduction, resulting in loss of sensation in a specific part of the body while maintaining consciousness. This technique is commonly employed in minor surgical procedures, dental treatments, and outpatient interventions. Shahad mechanism of action. Local anesthetics work by blocking voltage-gated sodium channels on nerve membranes. This action inhibits the generation and propagation of nerve impulses, preventing the sensation of pain from being transmitted to the brain. TASH types of local anesthesia. 1. Topical anesthesia, applied directly to the skin or mucous membranes, e.g., lidocaine cream or spray, commonly used for minor procedures like suturing small wounds or inserting catheters. 2. Infiltration anesthesia, injected directly into the tissue around the surgical site to block nerve endings, suitable for minor surgeries such as mole removal or dental procedures. 3. Nerve block anesthesia, injected near a specific nerve or group of nerves to anesthetize a larger area, frequently used for procedures involving limbs, hands, or feet. 4. Regional anesthesia includes techniques like spinal and epidural anesthesia, targeting a larger portion of the body, often used in orthopedic or obstetric surgeries. Commonly used local anesthetic agents. 1. Lidocaine, rapid onset and intermediate duration of action, often combined with epinephrine to prolong its effect and minimize bleeding. 2. Bupivacaine, longer duration of action, suitable for prolonged surgeries. 3. Ropivacaine, similar to bupivacaine but with less cardiotoxicity. 4. Prilocaine, commonly used in dentistry and for minor surgical procedures. 5. Procaine, short-acting, used less frequently due to its low potency. Advantages of local anesthesia. 1. Safety. Avoids the risks associated with general anesthesia, such as respiratory depression. Consciousness. Patients remain awake and responsive. 3. Faster recovery. Minimal systemic effects lead to quicker discharge and recovery times. 4. Cost-effective, often less expensive than general anesthesia. 5. Reduced side effects, lower risk of nausea, vomiting, and postoperative complications. Minor surgical procedures, e.g., skin biopsies, laceration repair. Dental procedures, e.g., tooth extractions, root canals. Diagnostic procedures, e.g., cystoscopy, bronchoscopy. Pain management in childbirth, e.g., epidural anesthesia. Orthopedic interventions, e.g., hand or foot surgery. Contraindications, allergy to the anesthetic agent, infection at the site of injection, bleeding disorders, increased risk of hematoma formation, certain medical conditions, e.g., severe hypovolemia or shock for regional blocks. Possible complications. 1. Local complications, pain or bruising at the injection site, infection, nerve damage, rare. 2. Systemic complications, usually due to overdose or accidental intravascular injection, central nervous system, CNS toxicity, dizziness, seizures, or respiratory depression, cardiovascular effects, hypotension, bradycardia, or cardiac arrest. Precautions. Dose limitation, adherence to the maximum safe dose to prevent toxicity. Aspiration technique ensures the anesthetic is not injected into a blood vessel. Allergy testing, performed if there is a history of adverse reactions to anesthetic agents. Patient monitoring, continuous monitoring of vital signs during and after administration. Conclusion. Local anesthesia is a versatile and effective pain management technique in surgery, providing targeted numbness with minimal systemic effects. Its application requires thorough knowledge of pharmacology, anatomy, and patient-specific considerations to maximize safety and efficacy. Proper administration and vigilant monitoring are essential to minimize complications and ensure a successful surgical outcome.